Cancer and cancer treatments such as chemotherapy, surgery or radiation to the head and neck, and some medicines can cause changes in the way foods taste. Some tastes will get better over time, but for some people, taste changes can last for a year or longer. If you tried a food that didn't taste good, try it again in a month or so to see if it tastes better, because taste can continue to change. It is important to choose foods that taste good to you. When food doesn't taste the same, this can lower your appetite and lead to weight loss, which can make you too weak to finish your treatment. It is important to manage taste changes so that you can do your best to eat well during and after cancer treatment. Taking care of your mouth and trying a few tips on how you prepare your food can help. In general, it helps to add an opposite flavor to balance taste changes. For example, try adding something salty if food tastes too sweet, or try adding a sauce or a spice if food tastes too bland. If you have another chronic disease such as diabetes, kidney disease, or heart disease, talk to a dietitian about your dietary needs. Here are some tips you can put in your taste toolkit to help manage each of these taste changes. There are common taste changes that many people experience during and after cancer treatment. These can include having a bad taste in the mouth, or food tasting more bitter, metallic, salty, sweet, or bland than it used to. Click on the taste change that you're experiencing for tips to help you manage. If you have a bad taste in your mouth, keep your mouth clean by brushing your teeth and tongue with a soft toothbrush several times a day and before and after each meal. You can also rinse your mouth. Do it several times per day and before and after each meal. You can use flat club soda or make your own baking soda rinse. To make the baking soda rinse, mix 1 teaspoon of baking soda with 2 cups of water. Put the rinse in a jar and shake it well. Use the rinse a few times a day and throw out any of the rinse that you don't use within 24 hours. Get rid of bad taste with sugar-free lemon drops, gum, or mints. Avoid sour candies if you have a sore mouth or throat. If food tastes bitter, try having food cold or at room temperature, because it may taste better and have less of a smell than hot food. To balance bitter tastes, try adding something sweet like honey, maple syrup, or dried fruit to your food. If food tastes like metal, eat foods cold or at room temperature because they may taste better and have less of a smell than hot foods. Many people find that red meat can have a metallic taste during cancer treatment. Try having other foods that are high in protein, such as chicken or turkey, eggs, tofu, nuts, Greek yogurt, and cottage cheese. Add skim milk powder to milk, soup, and cereal to add more protein. Try adding something sweet when you cook or use a sweet sauce. Try marinating meat, chicken, and fish in a sweet sauce, such as pineapple juice, teriyaki sauce, or barbecue sauce. You can also try eating meat or pork with a sweet dipping sauce, such as applesauce, cranberry sauce, or red pepper jelly. Balance metallic tastes with something sour or tart, like lemons, limes, oranges, vinegar, or pickles. But avoid these if you have a sore mouth or throat. Try to avoid using metal when you cook or store your food. Use plastic cutlery and try using glass pots instead of metal. Have fresh or frozen fruits or vegetables instead of canned. If food tastes too salty, look for lower sodium products. Look for words such as low sodium, reduced sodium, sodium-free, or no added salt on the package. Use the percent daily value to choose lower sodium products. Look for products that have 15% daily value or less of sodium per serving. Click on the can for a video on how to use the percent daily value. Balance salty tastes with something sweet like honey, maple syrup, fruit, or dried fruit such as dates or raisins. If food tastes too sweet, balance the sweet flavor with a pinch of salt, or with something sour like lemon or lime juice. Avoid this if you have a sore mouth or throat. Try adding frozen cranberries, buttermilk, plain yogurt, or decaffeinated instant coffee to milkshakes or nutritional supplements. Mix juice and other sweet drinks with water or ice. Mix with whole milk if you need extra calories. If food is bland or has no taste, try marinating food ahead of time using ingredients such as teriyaki sauce, sweet and sour sauce, vinegar, or lemon, lime, or orange juice. Use herbs and seasoning in your cooking, such as thyme, tarragon, and oregano. You can also try spices such as cumin, turmeric, and cinnamon. If your mouth is sore, avoid spicy food. You can also add more flavor at the table. Try flavoring foods with condiments such as soy sauce, mint jelly, ketchup, mustard, or barbecue sauce. Also add foods with strong flavors like chopped onions and garlic. Add something sweet and something salty for more flavor. For something sweet, try adding foods such as maple syrup, honey, fruit, or dried fruit such as dates or raisins. For something salty, try adding foods such as salted nuts, sharp cheese, or a pinch of salt. Remember these tips to help you manage taste changes. If a food doesn't taste good, try it again in a month or so. Keep your mouth clean, especially before and after eating. Brush your teeth and tongue. Use rinses like flat club soda or baking soda and water. Use your taste toolkit. If food tastes too bitter, metallic, salty, or sweet, use opposite flavors. If food tastes bland or has no flavor, use strong flavors. Have a nutrition question you want answered? Tweet us at ELLICSR Kitchen or leave a comment below.